Hey, future RNs! So glad you're back for part 2 of our myocardial infarction series. Today, we are going to tackle the stuff that you absolutely have to know for the NCLEX, the key medications, the scary complications you need to watch for, and, of course, that all-important patient teaching.
All right, so are you ready? Because we are about to master all of this. My goal here is to arm you with that high-yield, need-to-know info so you can walk into that exam room and just nail these questions. Seriously, they come up all the time. Let's get you prepped.
Okay, first things first, and this is a huge section on the NCLEX. We're talking about medications. I know. Trying to remember all these different drug classes, especially when you're stressed, can feel impossible. But guess what? I've got a super simple, kind of brilliant tool that's going to help you lock it all in. No stress.
You ready for it? Here it is. Acute angina means nasty artery blockages and cardiac complications. Kind of dark, but hey, it works. Every single first letter in that sentence stands for a critical drug category we use to manage an MI. So let's dive in and break down what each one means. So that first A is for anticoagulants and antiplatelets. Think of these guys as the emergency crew. Their job is to stop that clot from getting any bigger and prevent any new troublemakers from forming. Now for heparin, the magic number you have to remember is the PTT. We're aiming for that sweet spot, a therapeutic range of 60 to 80 seconds. If it's too high, whoa, your patient's risk for bleeding goes through the roof. And for things like aspirin and Plavix, it's the same story. Bleeding is the big concern. You've got to be on the lookout for any signs of a GI. Next up, M is for morphine. This is the big gun, the heavy hitter you bring out when that chest pain just won't quit even after nitroglycerin. It works wonders for pain, but, and this is a huge NCLEX alert, what do you need to watch for? Yep, two big things. It can tank their blood pressure and slow their breathing way down. So what are your priority assessments? You got it. Blood pressure and respiratory rate every single time.
All right, moving on to N for nitrates. And the star of this show is definitely nitroglycerin. Its whole purpose in life is vasodilation. It's like a plumber for the coronary arteries, opening them up to let more blood flow through to that hungry heart muscle. Now, some side effects are pretty common, almost expected, like a headache or some flushing, but the one you have to be hyper-vigilant about? Hypotension. That blood pressure can drop fast, and that's a massive safety risk.
Okay, we're back to another A, and this one's for ACE inhibitors. These are all your pril drugs, right? Lisinopril, enalapril, you know the ones. They're awesome because they help the heart chill out and decrease its workload. But they have two side effects that the NCLEX loves to test you on. You listening? First, that annoying, dry, nagging cough that just won't go away. And second, and this one's super important, they can cause hyperkalemia. That's high potassium, which is no joke.
B stands for beta blockers. You'll recognize them by the OLO ending. Metoprolol, atenolol, they were kind of like ACE inhibitors by taking the pressure off the heart, slowing down the heart rate and lowering blood pressure. But here is the absolute most critical NCLEX point for beta blockers, especially for your diabetic patients. You ready? Beta blockers can hide the symptoms of hypoglycemia. Think about it. What's a key sign of low blood sugar? A fast, racing heart, right? Well, beta blockers prevent that from happening, so your patient might not realize their sugar is dangerously low. This is a massive, massive safety issue, and your teaching has to be crystal clear on this.
So what happens if your patient is on an ACE inhibitor and they develop that awful, nagging cough? They can't live like that, right? Well, that's where our final A comes in. ARBs, or angiotensin receptor blockers. You'll know these as the sartan drugs. They're basically Plan B. The biggest difference, and the reason we use them, is they don't cause that cough. But, and don't forget this, just like ACE inhibitors, they can still make potassium levels creep up.
Okay, on to our C's. The first one is for cholesterol-lowering drugs, and we're talking about statins. Think Lipitor. These are so important because they go after the root of the problem, right? They attack the plaque buildup that caused the heart attack in the first place. For your patient, the number one most important thing they need to tell you about is any new muscle pain. This isn't just a little soreness. It can be a sign of a really serious condition called rhabdomyolysis, so it cannot be ignored. And for you, as the nurse, you'll be keeping a close eye on their liver function.
And our last letter, the final C, is for calcium channel blockers. Just like nitrates, these guys help with vasodilation, opening up those vessels to improve blood flow. So of course, you'll be watching for a low heart rate and low blood pressure, bradycardia and hypotension. But here's the quirky, unique side effect that the NCLEX just loves. These drugs can cause something called gum hyperplasia, where the gums actually get bigger and swollen. Kind of weird, right? That's why teaching about really good oral hygiene is so important.
Whew, okay, you made it through the medication gauntlet. Amazing job. Now, let's switch gears a little bit, because knowing the meds is one thing, but recognizing what can go wrong after an MI, well, that's where you really shine as a nurse. And you better believe the NCLEX is gonna test you on it.
Okay, so there are 3 big, scary complications you need to have on your radar at all times. Number 1, deadly dysrhythmias, like VFib or VTach. That heart muscle is damaged and super irritable, which is why your patient is glued to that cardiac monitor. Number 2, heart failure. It makes sense, right? The pump is broken, so it can't push blood forward. Where does the fluid go? It backs up, right into the lungs. So if you put your stethoscope on their chest and hear crackles, that's a huge red flag. And finally, number 3, bleeding. This is a direct result of all those powerful anticoagulants we just gave them, so you're watching them like a hawk for any and all signs of bleeding.
All right, fast forward a bit. Your patient has made it through the acute phase, they're stable, and they're about to go home. This, right here, is where you, the nurse, become the most important person in the room. Your role as an educator is everything. Seriously, the teaching you provide can literally prevent them from having another heart attack. And you know the NCLEX is going to hit this topic hard. So let's go through the must-do, high-yield teaching checklist. You have to make sure they get their meds, not just what they are, but why they're taking them and what side effects to report. You also have to stress that pills are not a magic bullet. They don't replace diet and exercise. And see how it all connects? We're teaching patients on beta blockers to check their own pulse and blood pressure. And for our diabetic patients, we're drilling it into them. You have to be extra careful about checking your blood sugar. It all comes full circle.
Okay, deep breath. You have taken in a ton of information. You're doing great. Now for the fun part. Let's see how much stuck. We're going to do a quick NCLEX drill to put your knowledge to the test. I'll read the question and the options, give you a second to think, and then we'll walk through the right answer together. You ready? Let's do this.
First question. You have a client on a heparin drip for an acute MI. Their latest PTT comes back at 110 seconds. What is your priority action? Number 1, document the finding as therapeutic. Number 2, stop the heparin infusion. Number 3, administer a PRN dose of aspirin. Or number 4, increase the heparin infusion rate. Take a second.
And the correct answer is number 2, stop that infusion. If you got that, awesome job. A PTT of 110 is critically high. Remember our magic window? 60 to 80 seconds? This patient is swimming in heparin, and the risk for a major bleed is huge. Your first and most important action is to turn it off.
All right, question number 2. This is a classic which statement indicates a need for further teaching question. So you're listening for the patient saying something wrong. The patient is prescribed lisinopril. Which statement is the red flag? Is it 1, this medication can increase my potassium levels? 2, I will report any muscle pain or weakness immediately. 3, I should call my doctor if I develop a persistent dry cough. Or 4, I will use a salt substitute to lower my sodium intake.
The answer here is number 4. That statement, I will use a salt substitute, should make your nurse alarm bells go off. This is such a common NCLEX trap. Why? Because those salt substitutes are packed with potassium. And what do we know about ACE inhibitors like lisinopril? They also increase potassium. Put them together and you're setting your patient up for dangerously high potassium levels.
Okay, last question. Let's finish strong. What is the single most essential instruction you need to give a diabetic client who's just been prescribed a beta blocker after a heart attack? Is it 1, avoid grapefruit juice? 2, this medication can mask symptoms of low blood sugar? 3, you might get a nagging cough? Or 4, maintain good oral hygiene? Think about it.
Yes, the answer is number 2. Absolutely. This is a life-or-death safety issue. Beta blockers hide those warning signs of low blood sugar. The patient can't rely on feeling shaky or having a racing heart anymore. They must check their blood glucose regularly. This is absolutely non-negotiable teaching.
And there you have it. That's our deep dive into MI meds, complications, and patient teaching. We cover the key drugs, the biggest dangers to watch out for, and the absolute priorities for discharge teaching. You are so much more prepared for these questions now. Keep studying, keep pushing. You are going to do great. You've totally got this. Thank you so much for spending some time with me here at ClearPath NCLEX. If this helped you feel even a little more confident, do me a favor and hit that like button, and definitely subscribe for more high-yield content just like this. Oh, and hit that little bell so you never miss a new tip. I have a question for you. Drop a comment below and tell me, which MI medication scares you the most? I promise I read every single comment. Okay, that's all for now. Keep up the incredible work.